Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, what is the management of thyroid storm? So, management of thyroid storm include first, the drug propyl thiouracil is the drug of choice for thyroid storm, and this propyl thiouracil is given in the dosage of 250 milligrams orally 4 times daily, that is QID. And this will, what does this propyl thiouracil do? It will block the thyroid hormone synthesis. That is one. Then we can also give cholazole iodine. What does this cholazole iodine do? This cholazole iodine will reduces the release of thyroid hormone. Okay, then there is sympathetic symptoms are also common in thyroid storm. So we give propranolol. Propranolol. This propranolol, what does it do? It will control the sympathetic activity, and thus it will also decrease the, and thus it will reduce the cardiovascular side effects which are seen due to increased sympathetic activity. So this propranolol is actually given in the dosage of 40 to 80 milligrams daily orally. Then we can give hydrocortisone. Hydrocortisone is given as 50 milligrams intravenously 4 times daily. And this hydrocortisone is mainly added if the patient is in shock. Then this hydrocortisone also blocks the conversion of T4 to T3.
thank you and thank you for watching.